2024 Childhood, the Summit to End Childhood Lead Poisoning. Thank you for joining us today on a day focused on safeguarding our vulnerable communities, and namely our children, from the devastating impact of childhood lead poisoning. My name is Riley O'Brien. I'm an attorney in the Community and Civil Rights Unit at the Rhode Island Attorney General's Office. I work on cases particularly regarding lead poisoning. The cases are particularly difficult to handle because we all understand the lifelong impact that childhood lead poisoning can have on these children, and we all know that it is also preventable. And everyone in this room, I hope, knows that as well. That's why we're here, to do what we can to to handle the insidious effects of childhood lead poisoning and end it once and for all. I'm very excited to spend the day with you today. Thank you all for coming out. I'm going to introduce you now to my wonderful colleague, Ariana Bach.
Good morning, everybody. So glad to see all of you here today. My name is Ariana Bach, and I'm the Civil Rights Coordinator at the Attorney General's Office. We would like to start off today by thanking Rhode Island College for allowing us to hold our summit on their beautiful campus. Thank you, Rick. And they're my alma mater, by the way, so very excited to be here. We would also like to thank the wonderful staff at the Rhode Island Department of Health who have collaborated with our office to help this event be an amazing success today. So thank you all, the staff at the Rhode Island Department of Health. Finally, a big thank you to the staff at our office who has been working diligently for months to prepare for this event. A special thank you to Eleni Elliott, who is the Civil Rights Unit paralegal, who has been working very hard, long hours to make sure the success of this event goes well today. So thank you, Eleni. We'd like to give her a little round of applause.
We'd also like to thank, of course, our very own Attorney General, Peter Neronha, who will be speaking later this afternoon. He's been a tireless public health advocate throughout his administration. He's worked to shed light on the lead poisoning crisis here in Rhode Island and has provided the tools necessary to hopefully eradicate this insidious problem. Finally, thank you all for joining us on what promises to be a day full of important discussions and meaningful insights.
Please join us in welcoming our colleague, Keith Hoffman. Keith is the chief of the Civil and Community Rights Unit at the Attorney General's Office, who will introduce our first speaker of the day.
Thank you all. It is my distinct pleasure to introduce Senator Jack Reed this morning. Senator Reed has worked for years at the federal level to address the dangers of lead poisoning and exposure in Rhode Island and nationwide by increasing funds to remove lead-based paint from homes, educating families about the dangers of lead poisoning, and training inspectors and workers to identify lead contamination in housing. As a result, over the last decade, the incidence of lead poisoning across Rhode Island in tests of children under the age of 6 has dropped dramatically. We are so grateful for Senator Reed's leadership in this area. Thank you so much for joining us today, Senator.
Well, thank you very much, Keith, and good morning, everyone. This is a very critical, important topic because the dangers of lead poisoning are obvious to everyone here, and I think it's important that the Attorney General is involved because you protect civil rights, and I think one civil right is to be able to grow up safe and healthy regardless of your economic or status in any other way. So thank you. Attorney General Neronha will speak later. He's an extraordinary public servant, and I'm not surprised she's leading the way along with the Department of Health. So, Deputy Director Dixon, thank you for your great work. I also like to acknowledge Laura Breon of the Childhood Lead Action Project, who's been advocating for children around for a long, long time. So thanks, Laura. Yeah. It's really an honor to be here to highlight the vast reduction in the rate of lead poisoning among children here in Rhode Island. When I was first elected to Congress in 1990, the rate was really out of control. We weren't paying enough attention to housing quality, and we were ignoring the problem. And in a collaborative effort with state officials, federal officials, we started to try to get a hold of this problem. And we've seen significant reductions in exposures in children, which is great. It's a preventable tragedy. That's what's so disturbing. This is not something baked into your genes. This is just being, unfortunately, too wealthy to live in a house that's lead-free. And we have to deal with that, and we are. According to the CDC, children in at least 4 million U.S. households are exposed to high levels of lead, and that is 4 million too many. In Rhode Island, there are 413 children entering kindergarten this fall with rates of lead above the threshold. One of the things we've done is we measure every new child going into school for their lead exposure, so we can identify early children who need medical health assistance, and also their homes can be hopefully corrected. As I mentioned, the numbers are declining, but not quickly enough. And this is a matter, as I've suggested, of equity as well as public health, because the burden of this dilemma is on the poorest communities, the poorest areas, low-income neighborhoods in minority communities. And the essence of this country is everybody gets a fair chance in the race of life, as President Lincoln said. And one way that we can do that is make sure that lead exposure is not persistent in these communities. We have to ensure that every child has an opportunity. And that's, again, the essence of this country. And one way to do that is to get the lead out, literally. And we've been trying to do that. At the federal level, I've been working a long time to increase investments in programs designed to address lead poisoning. And these federal programs can help eliminate lead-based paint hazards, educate families, and protect our most at-risk children. I learned as a young congressman a lot about lead, and in the old homes in central cities, prior to 1978, the paint was all full of lead until we took it out in 78. And they would tell me, all you have to do for an old house with lead paint that's like 5 coats is just raise and lower the windows 5 or 6 times, and you have this lead mist that is spreading all over the house. Well, paint is better. We took the lead out, but we still have old homes that have to be corrected. And if you are a child exposed to lead, you are 7 times more likely to drop out of school, and 6 times more likely to end up in the juvenile justice system. This is I don't know, I'm a bit lost for words, but if we don't fix this, this is just dumb, frankly. Because all we're doing is clogging up our juvenile justice system, preventing people from learning anything, in fact, ruining their lives and making them socially dependent and economically dependent their whole life. So any rational person would get it. We gotta fix this. As I said, they're not only the right thing to do these programs, they're the smart, efficient, thoughtful way to do these programs. Now, on the Appropriations Committee, which I serve, I've worked to increase federal funding to protect children from these dangers. And I also worked to increase funding for the CDC's Childhood Lead Poisoning Prevention Program. And as a result, the Rhode Island Department of Health has been able to do their critical prevention and surveillance work. The CDC program is the only federal initiative to provide funding and support to states and local health departments to conduct vital surveillance of where, how, and when children are exposed. This surveillance information is absolutely essential. We know where the problem is. We know who's been affected. We can treat the child, and we can fix the facility. Without that surveillance program, we would not do that. And we also understand that there's a large source of lead in old lead drinking water lines, underground pipes that connect to the water system. Replacing lead pipes is costly. It's not like just going in and putting new windows in. It's pretty expensive, but it's worth every penny. And I am very glad the state is already tapping into $141 million dedicated to lead pipe replacement in Rhode Island that I helped along with my colleagues to secure the bipartisan infrastructure law. We're already working, we're going to get it done. Every child deserves clean drinking water, safe and healthy homes, and we have to work to make that a reality. And you are going to do this great work, and I'm very proud of you. Good luck, have a great conference, and remember, this is the smart thing to do, and it's the right thing to do. Thank you.
Thanks, Senator Reed, for being here today and for your thoughtful comments this morning. We'd also like to thank Senator Whitehouse and his office for all their support in this critical project. Unfortunately, the Senator himself was not able to be here, but he is represented by a member of his staff, Nick Vinciletti, so thank you for being here, Nick.
Just walk us through what brings you out today.
Well, today is a very important meeting with respect to child lead poisoning. I want to commend the Attorney General and other state leaders for the efforts they've taken. Lead exposure in children can be incredibly harmful, particularly to cognitive abilities, and it could in many cases ruin the capacity of a child to learn, to grow, develop, and become a creative citizen. So I've been spending, since I got elected to the House of Representatives in the 90s, a great deal of time getting the resources available to eliminate lead, both in houses and also in the lead water pipes that lead from the main street mains. And we put a lot of money into the infrastructure bill so we could replace those water lines, and the state's moving out very smartly. But today is just an assessment of where we've come and how far we have to go. We're making progress, but we've got more to do.
What do you think the process is of trying to correct this big issue?
Well, the process basically is identifying those rental properties typically that have lead exposure to children. The state has done a very good job of creating a registry. We've been funding that registry through the CDC, the Communicable Disease Center in Atlanta. So they're providing resources, and we're getting a better feel of how many children are exposed. There's requirements to be tested for lead as you enter school. That's another way we can find lead. And then we have to remediate it. That's money. That's carpenters and houses. That's industrial workers to get new pipes into the water system. And we're working on that.
It's clearly a very big issue. Why do you think it's important to have events like this and just kind of get that message out there and to make people understand how big an issue this really is?
Well, because the effects of lead exposure on children are subtle, but they're really terrible because it can ruin your neurological ability literally to think. And it creates a situation in which a child can't be competitive in school or competitive in life, and it's something that can be completely avoidable. So we have to get that message out constantly to rally support for the funds and for the programs that help kids.